Since Jeff started working for Covenant Health Occupational Health and Safety, he's demonstrated respect for both his employees and for the leadership team he works with.
He's shown a lot of respect by going to the sites. He visited all of them and talked to them about, what type of patient-resident handling program would suit Covenant Health and how we can assist in that area.
When I start on any new project, it really starts with listening. So many times you can get some incredible ideas from people that work in the front line.
He really is a fantastic leader in trying to show the respect for his staff. He will actually go downstairs, speak to them as much as possible, really engage them, text message, phone them, email them.
I like having that face-to-face interaction and not always having it by email. There's not a lot of staff that I get to have face-to-face with.
We're really quite fortunate to have Jeff as part of the team.
First and foremost, GERI does her job extremely well. She's very connected to the residents and the people we serve. Let it be watering her flowers or folding her comforter up a certain way, or the resident might like to look out the window at a certain direction, so she'll angle her chair in that direction.
So she does extra little things for her. I get flowers, she waters them, or other people get flowers. She waters them also.
She just does those little things so well because she really knows that resident and she really respects her for who she is and why she's here.
We spent many years treating the diseases associated with smoking, but realized, what are we doing actually about smoking? We would introduce a protocol that would help patients make a quit attempt if they so desired.
John, for instance, was dealing with a patient over at Villa Caritas. The person was essentially a terminal patient. They didn't want to give up smoking, and yet they had an oxygen tank. So he came up with a strategy to accommodate for that, just out of compassion and out of respect for it.
Not treating someone as a second-class citizen because they smoke. It is an addiction.
They're also really committed to working with the staff and giving them the background information and what they need to do it and feel comfortable talking about smoking to patients.
When someone has a passion for it, then it shows their love for the other individuals that have problems smoking. And without that passion, I don't think that this program could be a success at all.
Michelle is the first and last face that every patient who comes through the doors at IRSM sees. And she treats everybody as if they were family. She welcomes them.
I would show respect to people when they arrive by making them feel as welcome as possible.
She acknowledges that some of them will have difficulties with speech because a lot of our patients are disfigured facially, and she takes that into account. And not that she treats them any differently than she would anybody else, but she recognizes some of those challenges in our patients.
There was a young woman, she heard the tapping of my shoes when I walked by, and she looked around and she said, "I can hear you tapping, I can hear you tapping." And she was half crying and half laughing, and those are really good days.
Nikki shows respect every day. She is very kind and sweet to employees, to her patients especially.
She's so cute. I mean, she never calls me by my first name. She always calls me boss. I mean, that's just something unique about her. That's just what she does.
Respect is a big word. A lot of people want respect, but not everybody ready to give it.
Extremely intelligent young lady. She came to me to say she was going to go and take the course at STARS. She felt in order to give a full degree of care for our clients that she needed to know how the STARS team performed, and she wanted to absorb their knowledge. For all the knowledge base that she has, she never talks above somebody.
I would say Dr. KRUHLAK has been an absolute wonderful example of respect. He, in his every dealing with people, is always respectful.
He's an excellent physician for pediatric patients, kind of get their mind off the situation that they're in.
I think we're all sort of working towards a common goal that, you know, treating individuals as we would like to be treated ourselves in the department.
He's one of the most approachable doctors we have.
His advocacy for vulnerable, and particularly with mental health patients.
Very patient with taking questions and any concerns the families might have, and you know, he's an approachable guy.
Well, there's a few things about Ryan. The first thing is that he knows all the residents by name. When I come to work and I look at Ryan, and he's always positive and smiling and happy and energetic, and he's very outgoing.
He would come and practically bow before them when he served at the table. He's so joyful. He served each one so respectfully.
I enjoy seeing the residents. I enjoy listening to their stories and just talking to them and just seeing the smiles on all their faces.
A lot of people talk about him as being the perfect little gentleman.
There's times where, you know, a resident will ask for something specific, and Ryan will go out of his way to make sure that they get that.
Veronica is always respectful. She treats her job with the highest respect. She's a lovely team player.
Veronica has brought down and passed down a lot of values that the nuns have and instilled in her when she was here for so many years.
Well, respect is used any time that you are with any other person. I think that everybody has a value and everyone was made equal, and we should be treating them that way as we work.
She always looks for the best in people, and she brings out the best in people.
Dr. Shanowski is a physician who is devoted to his calling, to his profession, and then by extension to the residents and to the patients that he provides care for.
Respect to me means that I value all people, including all the residents that I have under my care and all the staff.
He listens, he comes down to the patient's level. If they're sitting down there and he's standing up here, he'll come down to their level to talk to them. He's always got a smile for everyone, the residents, the staff. He's got a smile for everybody.